Chairman, House Committee on HIV/AIDS, Tuberculosis, Malaria Control, Honorable Amobi Ogah says the House of Representatives will ensure full operationalization of HIV and AIDS Anti-Discrimination Act 2014 to address discrimination in workplaces. According to him, the act makes it illegal to discriminate against people based on their HIV status and prohibits employers, individuals, or organizations from requiring HIV tests as a precondition for employment or access to services.
Let me assure Nigerians and the whole world, especially the community of people living with HIV/AIDS, that we are fully with them and we join them to fight the harmful stigma and discrimination that hinder people living with HIV from fully realizing their potentials. We will do everything within our powers to ensure HIV/AIDS Anti-Discrimination Act 2014 that makes it illegal to discriminate against people based on their HIV status, which prohibits any employer, individual, or organization from requiring a person to take an HIV test as a precondition for employment or access to service becomes fully operational. The ATM committee to implement a progressive legislative agenda that Nigerians can be proud of and that is able to provide the needed operational environment towards achieving the SDG Goal 3 to end AIDS and tuberculosis by 2030.
Dr. Eche Ijezie, AIDS Healthcare Foundation Country Program Director, said World AIDS Day is a global event which gives opportunity for people worldwide to unite and show support for those living with HIV and AIDS.
It's an annual event, and we're using the opportunity to plead with global leaders, to world leaders, to place HIV high on the health agenda, to ensure that resources are available, to ensure that communities are allowed to lead, and to remind each and every one of us that it is not yet over. The fight against HIV/AIDS is not yet over. A lot of work still needs to be done. A lot of work has been done, but more work still needs to be done, particularly ensuring that communities are allowed we are letting communities to lead and reminding ourselves that it is not yet over. The fight is not yet over. We're raising awareness, we're ensuring that that prevention services are available, testing services are available, and care and treatment services are also available.
The State Clinical Coordinator of AIDS Healthcare Foundation Abuja said the foundation was focused on providing cutting-edge medicine for persons living with HIV and AIDS, regardless of their ability to pay.
One of the key things we do in terms of following up with people living with HIV to ensure that they live and thrive in an enabling environment is for us to engage the community. That is why the team for this year, the global team, is what? Let community lead. AHF itself, our team is not over because we know that it's not yet over. We want to make sure by 2030 we eradicate HIV totally in Nigeria with the goals of UN/AIDS 95 strategic goals. These strategies will help everybody that is living with HIV to actually come out and be on treatment.
The 2023 World AIDS Day, with the theme Let Community Lead, aims to highlight the pivotal role communities play in shaping the HIV response and global health.